What is biomarker testing and how do results impact treatment options?
Great question. So I think, people often confuse germline mutations and somatic mutations. So I'll talk about that a little bit as we talk about biomarkers. So I think, biomarkers in general are factors within the tumor that allow us to help make treatment decisions. So if a biomarker in the tumor can predict response to a certain type of treatment, we want to know what that biomarker is so that we can, better treat the patient and kind of more elegantly design a regimen. So for example, having an estrogen-positive tumor, estrogen positivity is a biomarker suggestive of response to anti-estrogen treatments, which is why we give anti-estrogen therapy to ER-positive breast cancers. But more recently, we've sort of, been able to move a little bit beyond estrogen, HER2, and triple negative as sort of our subtypes, and think a little bit more in some patients about more sophisticated biomarkers. And that's where somatic mutation testing comes in. So there are germline mutations, which are inherited mutations that are present in every cell of your body. So for example, if your mother was a BRCA mutation carrier and passed that BRCA mutation down to you, you would have a germline BRCA mutation. So your cancer would carry a BRCA mutation, but so would every other cell you have. And that's a biomarker that would make you a candidate for treatment with something like a PARP inhibitor. But in cancers, which, kind of the genes in the cancer have gone awry by definition, there are often other biomarkers within that tumor that may make you a candidate for certain treatments. And so those mutations that arise in the cancer itself are called somatic mutations. Those are mutations in the tumor, can't be passed down to your offspring or anything like that, and were not inherited by your parents, but mutations that have accumulated over time as these cancer cells have kind of gone awry. And so genomic testing or biomarker testing can be done often on a metastatic specimen. So to be specific about it, say you had a metastatic breast cancer to the liver. You could have a liver biopsy done, and that tissue from the liver biopsy could be sent for genomic testing. There are a lot of companies that do this, and then there are also some larger cancer centers that actually do in-house testing for genomics. And so this testing can be done, and what it does then is helps you determine, do you have a biomarker that predisposes you to a certain treatment? So if that metastatic liver tissue, for example, contained high levels of PD-L1 expression, for example, and you were triple negative, that would say to your doctor, ooh, this is a great candidate for immunotherapy along with chemotherapy. Or if you're estrogen positive, for example, and your tumor contains a mutation in a gene called PIK3CA, then that might make you a candidate for a drug called alpelisib. So these mutations can often be kind of paired to a drug or treatment option, or sometimes to a clinical trial, to allow patients to kind of take advantage of more targeted therapies that sometimes, because they're targeted, have fewer side effects than drugs that are a little more indiscriminate.
Mm-hmm. Marie sent in this question prior to the program. Yeah. Are there some genetic tests that are more accurate than others?
It's a good question. I would say, most genetic testing platforms have been heavily vetted and approved by, national organizations and laboratories, and have been tested multiple times before they're allowed to, be marketed. So I wouldn't say that one genetic testing program is necessarily better than another. I think that any of the commercially available platforms that are used are probably pretty accurate. I was just going to add one thing to that last question, if that's okay. I would say that I think it's important when you're using genetic testing platforms, though, to know what you're testing for. So there are some platforms that will just test for, say, like the 3 most common mutations in BRCA1 and BRCA2 that Ashkenazi Jews have. And so if you get that testing back and you're negative, you might think, oh, I don't have a mutation in those genes. What we know from that testing, just as an example, is that you don't have a mutation in those 3 alleles of that gene. But if you haven't had full gene sequencing, you could have a mutation somewhere else in that gene. So I would say, all genetic testing that's commercially available is probably pretty accurate, but it is important when you get testing done to know what you're testing for and what you're not testing for, so you can interpret your results accurately. And genetic counselors, as well as your doctors, can help you do that.